Most men miss the very first warning sign. They think it's aging. They think it's normal. But what if it's not? Prostate cancer often starts with symptoms so subtle, most men brush them off for months, sometimes for years. And here's the truth. When you catch it early, treatment works incredibly well. Today, we're counting down 10 early warning signs of prostate cancer that doctors want you to notice. By the end of this video, you'll know exactly what to watch for. Let's get started. Prostate cancer is one of the most common cancers in men. About 1 in 8 men will be diagnosed in their lifetime. But here's the good news. When it's found early, the survival rate is nearly 100%. The challenge? Early prostate cancer usually doesn't cause any symptoms, and when symptoms do appear, they can look like normal aging or everyday bladder issues. Before we dive in, remember, having these symptoms does not mean you have cancer. Most are caused by harmless conditions like an enlarged prostate or an infection, but they do mean it's time to talk to your doctor. Alright, let's count down the 10 early signs. Sign number 1, trouble starting or stopping urination. This is one of the earliest signs men ignore. You might stand at the toilet and wait for the stream to start, or you finish, but it still feels like a few drops keep coming. When the prostate presses against the urethra, the tube that carries urine out, flow becomes harder to control. Yes, aging can cause this, but when it becomes a pattern, it's worth getting checked. And here's the key. Your doctor can tell the difference between harmless prostate growth and something more serious. Sign number 2, weak or interrupted urine flow. If your urine dribbles, stops and starts, or feels unusually slow, pay attention. This happens because the prostate blocks the normal flow of urine, forcing your bladder to work harder. If your flow has changed for more than a week or 2, that's your signal. That change alone is worth a conversation with your doctor. Sign number 3, frequent urination, especially at night. Getting up once at night isn't unusual, but 2, 3, or 4 times every night, that's a sign your bladder is being irritated or squeezed. This symptom is called nocturia, and it's one of the most common early signs of prostate issues. If nighttime bathroom trips are becoming a pattern, don't ignore it, especially if nothing else in your routine has changed. Sign number 4, pain or burning when you urinate. Men often assume this is a bladder infection, but when pain or burning keeps returning or lasts longer than a few days, it may point to something happening in the prostate. The key word here is persistent. Brief irritation is normal, but pain that lingers? Have it checked. Sign number 5, blood in your urine or semen. This one is hard to ignore, and it should be. Blood in urine can make it look pink, red, or brown. Blood in semen may appear as streaks or a rusty color. There are many causes for this, including infections or kidney stones, but blood is always a sign to see your doctor right away. No exceptions. Sign number 6, new or worsening erectile dysfunction. Erectile dysfunction is common as men age, but when it happens suddenly or gets worse quickly, your prostate may be involved. Cancer in the prostate, or pressure around it, can affect nerves and blood flow much earlier than people realize. If something has changed in your sexual function and you can't explain why, that's your cue to get checked. Now, the next 4 symptoms are the ones doctors say men ignore the most. Let's keep going. Sign number 7, pain in the hips, lower back, or pelvis. Here's the sign that's missed more than any other. Dull, achy pain in the hips, lower back discomfort that won't go away, pelvic pressure that feels off. Many men blame sitting too long, age, or old injuries, but here's what doctors know. When prostate cancer spreads, it often goes to the bones first, especially the hips and spine. But bone pain can also happen when the prostate itself is inflamed or infected, which is why any persistent pain should be checked. Pain that sticks around for weeks, even after rest or stretching, don't ignore that. Sign number 8, unexplained weight loss. Losing weight when you're not trying can seem like a good thing, but when the weight drops fast and without changes to diet or exercise, it can be a warning sign. Cancer changes how your body uses energy. It can burn calories faster and affect appetite without you realizing it. If you lose 10 pounds or more in a few months and you don't know why, get evaluated. Sign number 9, persistent fatigue. This isn't normal tiredness. It's a deeper kind of exhaustion where even after a full night's sleep you feel drained. Fatigue like this can happen when your body is fighting something or when red blood cell levels drop. If this heavy, unshakable tiredness has been going on for weeks, mention it to your doctor. And sign number 10, rectal pressure or bowel changes. The prostate sits right next to the rectum. A growing prostate, or a tumor, can create pressure in ways men don't talk about. You might feel constipation, pressure when sitting, a sense of fullness, or discomfort during bowel movements. This is less common, but still important. Changes that don't go away deserve attention. Advanced prostate cancer creates more obvious signs: severe bone pain, swelling in the legs, numbness or weakness in the legs, losing control of the bladder or bowels. These require immediate medical attention. The good news? Even advanced prostate cancer has more treatment options today than ever before. But early detection makes everything easier. So what should you do if you're experiencing any of these symptoms? First, don't panic. Most symptoms are caused by non-cancerous conditions. Second, track the symptoms. Write down what's happening, how often, and for how long. Doctors love clear information. Third, schedule an appointment. You are not bothering your doctor. This is exactly what they're here for. Fourth, ask about screening. If you're over 50 or over 45 with higher risk, PSA testing is a simple way to catch problems early. Fifth, know your family history. If your father or brother had prostate cancer, your risk is higher. And finally, take care of your health. These symptoms don't define you. Taking action does. Let's quickly recap the 10 early warning signs. Sign number 1, difficulty starting or stopping urination. Sign number 2, weak or interrupted urine flow. Sign number 3, frequent urination, especially at night. Sign number 4, pain or burning when urinating. Sign number 5, blood in urine or semen. Sign number 6, new or worsening erectile dysfunction. Sign number 7, pain in the hips, back, or pelvis. Sign number 8, unexplained weight loss. Sign number 9, persistent fatigue. Sign number 10, rectal pressure or bowel changes. Remember, symptoms are your body's way of getting your attention. Catching them early can literally save your life. If something has changed and it's not going back to normal, get it checked. If you found this video helpful, please give it a thumbs up and share it with the men in your life. Your health matters, you deserve answers, and you're not alone. Thanks for watching and take care of yourself.